NBC News medical contributor Dr. Vin Gupta joining us live. I know your Twitter handle says wear a mask, and you've got the emoji on there as well. I want to talk to you about this new survey from the CDC that found more than half of the people who tested positive for the virus didn't know how they contracted that. We talk about contact tracing. What does that mean for that process and for our viewers who are listening in on this?
Thanks for having me. Yeah, I think this shows that, and evolving data is even corroborating that coronavirus is so difficult to control because it's so easily transmissible. That asymptomatic spread is likely. We think some studies suggest 8 in 10 cases are because of asymptomatic transmission, which is why wearing a mask, which is why hand hygiene, infection control measures, social distancing, these things that we've been talking about since March are so important, because you can't screen for a fever. You can't screen for shortness of breath the way you could with flu or with other common respiratory pathogens. It hides. And so that's why this is so difficult. And that's why I'm not surprised to hear that survey data.
Leaders here in the Tri-State say those masks are helping to lower our infection rates and to help with the progress we've seen here. In fact, New York's infection rate is low. We're starting to see it creep back up. I think it was on Monday, it was less than 1%. Today, it's 1.38%. For those of us who are watching these numbers closely, at what point should we be concerned about seeing these upticks in numbers?
At the point at which that threshold is 3% and higher. So once we cross 3% in New York and in places like California, Florida has a 16% infection positivity rate. So of all the tests that are being done, 16% of them are positive. New York, to your point, it's about 1.1% or so. Once you hit 3%, and if you're going in the wrong direction, if that's climbing up, that's when you want to be worried, because we know that countries that are below that threshold are able to do contact tracing, are actually able to identify positive contacts of those that are confirmed positive, isolate them, test them, and then that way we can actually go towards more of that quarantining and containment strategy and renormalize life. But if it's higher than 3%, it's hard to do contact tracing and to justify that investment, because then we think the outbreak is potentially getting out of control. So that 3% number is really key.
Good to put that in perspective, and interesting to see all the progress we've made in these last few months. Dr. Vin Gupta, always appreciate your insight. Thanks for joining us.